welcome to the Triumphant Birth Podcast. I'm your host, Jamie Raisleger, and today I have, even though this is only the second episode, I have something a little bit different because I wanted to give our listeners a chance to get to know me a little bit better as your host. And so I thought about doing a separate one-off solo cast, which would be more like a meet the host situation where I'm just talking at you. And what I decided on was, instead of that, I am going to, this next conversation that you'll hear for today is actually my birth story. And while it may not seem like just someone's birth story is telling of who they are, I do think that because of my whole journey, it does give some detail and some pretty good insight into who I am as a person. It starts in my childhood and continues to right now. So if you are interested in that, this next conversation is with Dr. Stu and Bliss Young. I had the incredible privilege of being on their podcast, the Birthing Instincts podcast. And I really hope you will enjoy this conversation. And then next week, I'll come back with a full guest episode. It's also perfect timing to have this rebroadcast of the Birthing Instincts podcast for this week, because I am freshly off of my first birth that I attended. I shouldn't say my birth. I'm freshly off of the first birth that I attended since having my twins in March. So I hope that you will love this episode, and I am going to go take a nap. Love you guys. Bye.
Oh my goodness. Jamie, welcome. Oh my God.
Welcome, welcome. Stu was just telling Jamie that I have absolute veto power. I don't know that that's so true, but you know.
That's because I was saying we as the proverbial we, and you said we do this. No, it's like I do this. So. Right.
We are so lucky to be joined by Jamie, who we read her letter a few months ago. So you guys might be a little familiar if you're a common fellow traveler that the story sounds familiar. And at the end of Jamie's letter, she let us know that we were all going to be gathering together at Nathan's Twin and Breech conference. And I had the delight to sit next to Jamie and carry her baby around and do all kinds of fun stuff with your twins. So thank you so much for joining us today.
Absolutely. I'm so happy to be here.
Finally.
Yeah. So, Stu, where do you
actually, can I say something? Can I just say something?
Yeah.
I'm so happy to be here too.
Exactly.
It's been really hard, but I'm really glad that we fight, because Jamie, we've punted you around a few times, and I really do feel awful about that. So I'm very glad that we finally I'll just tell briefly. We tried to do this about 10 minutes ago, and I was in my room using the hotspot at the hotel, and the connection was horrible. So then I finally found the manager, and he stuck me in a conference room, which I actually feel, I got this really long table here, and it's an executive suite, and I feel like now I'm somebody. So
you've always been somebody. We're happy that you're back too, Stu. We've definitely missed you. I've missed you and our normal regular schedule that I could rely upon. So your adventures in Australia were definitely enviable, but we're so happy to be here all together.
No, I got one. I'm still in London, Ontario, Canada. So I'll talk with you, but we're going to know more about that because we've already talked about it. So.
That's right.
Oh my God. All right. So Jamie, we got to see the birth, and you talked about it at the Kentucky Breech Conference, and you've graciously allowed me to show that clip, that little video that you have of the birth. And a lot of questions have come up. But before we get to that, I want to go back and do your backstory. And a little bit more about how you got to the point now where you are. Just that's it. I won't even say any more. But not everybody was doing what you're doing, and a lot of women have given birth, and it hasn't changed their life course before. So tell our listeners, tell Bliss, tell me a little bit about how you got to be sitting in that chair right now.
Yeah, absolutely. So I have sort of the bullet point version of it because I'm assuming we want to dive into the birth as the bulk of the conversation. So um, I'll go back quite a ways, but it still will be the bullet point version. So I had a chronic pain condition when I was young. So when I was a teenager, that started in like the year 2000. So that's how far we're going back here. And I was told during that time that I probably would not be able to have kids. Just lots of medications, lots of doctoring around, lots of, I got to experience firsthand. That was my first introduction into the medical model for just in general. And I got ping-ponged back and forth. I was at Mayo Clinic for 3 weeks, just all around, all around, all around. And all the doctoring really damaged my trust in the medical system. As you can imagine, there was a lot of gaslighting, a lot of that sort of thing that is so common with birth now in pregnancy care. And I left that experience with some very real trauma from OBs and within other specialties as well. And ultimately in 2008, so this lasted 8 years, in 2008, my late grandpa introduced me to some alternative holistic methods of healing. He took me to a place in Michigan where I stayed for 10 days, and it ultimately ended up resolving my chronic pain. It was so holistic. It was dietary, of course, but it was also nervous system work, forgiveness work, all of that, truly holistic. That place sadly no longer exists, but that's what introduced me to a different way of thinking, because I grew up very mainstream in Wisconsin, farming community, very rural, all of that. So that's what ultimately resolved the pain. And then fast forward so I was going to undergraduate with a human biology degree, health sciences, and I was actually going to go to medical school myself, decided that maybe that's not the right route to go after that experience. And I just wanted to explore a little bit more. What is this all about? This holistic lifestyle, all this alternative stuff that we know is not really truly alternative. But so fast forward, I got an insurance job instead, which that's a whole nother story. But then I met my husband, got married, and then in early 2016, we decided that we wanted to start trying for kids. And so we made the mutual decision. We were waiting for my next cycle. And then before the time of ovulation, I had a stroke in my brainstem when I was 31. And that completely took us off guard, like just out of nowhere. And they still don't know truly why that happened after the full workups and all of that. There's some speculation, but nothing that they thought would require, surgery or anything like that. I have a teeny tiny PFO, patent foramen ovale, whatever,
Yep.
in my heart, but so do so many other people in the population. And it was so tiny that he didn't even hardly see it. And I know that because I did not consent to the sedation for the TEE procedure when they did that. So
TEE is
the transesophageal,
transesophageal
yeah,
e
echo.
echo. Right.
Yep. So it's when they put the camera down and they put it like under your heart and look at it to see if there's any holes or anything. There was something super tiny, but in the end, they said it was a fluke and not something that I should be worried about going forward. I did end up seeing, it took me a full year to recover, but I am fully recovered. I danced a lot in order to recover. So that was a fun part of it. But I saw an MFM to be like, hey, like what do I have to do? Is there anything that I need to be worried about? And he actually cleared me. He said, when the time comes, you may be on blood thinners or something, but really there's nothing that needs to be done. I was never on any medication. They did nothing in the hospital when I had the actual stroke except put me on aspirin and give me a B12 shot. So here I am fully recovered. And it was about 2.5 years later that I decided that, okay, my body is healed enough, balanced enough to try again for a baby. So we did one time we got pregnant on the first try, and that's our son who is 5 right now. And during that year, so that was 2018, during that year that we conceived our son, I had completed my doula training as well. I had attended a birth of my sister's in 2009, and then a few in between that time. And I caught the birth bug basically during that year. And so I was 5 or 6 weeks pregnant at my first birth that I attended, which was a home birth. It was a difficult primate birth that lasted 56 hours, and it was a transfer and a C-section. And I still decided that I wanted to do birth. So that's anyway, so that's kind of fast forward. And I loved what I saw so much between the consent and just the overall energy of a home birth versus everything that I felt and experienced when I was doctoring for the pain condition, that something was just an immediate yes for me. I'm like, yes, that's what I want. And that is the midwife who I hired to be there for our home birth for our son.
And how was that birth?
It was great on paper. It was wonderful. I mean, it was 12 hours of an active stage, really, really textbook, an hour and 50 minutes of pushing. His head was asynclitic for a while. My midwife knew all the rebozo tricks and all of that. So we worked together that way. I also had my Pilates instructor there who is a friend of over a decade, and she does something similar to like emotion code and body code with some muscle testing, things like that, and just how the emotions are held in the body. How can that be released through movement and speaking and other things? And through all of that, we were able to resolve my son's asynclitic head, and he came shooting out in projectile fashion. And he was great. He's, great APGARs, all of that. But the energy with that birth was desperation. It was like performance based, because I had been type A, kind of recovering perfectionist type up through that time. And as I was reflecting on that birth after it happened, I'm like, oh man, in my subconscious, proactively decided to dissociate because I did Hypnobabies, the Hypnobabies program. That's a really intense training program. And I'm even a Hypnobabies trained doula, but what it allowed me to do is dissociate from my body in a way that was acceptable. And because I'm like, I'm not getting an epidural, that wouldn't be acceptable for me. And, just a very different mindset. And then when it came to the pain, I was like, oh, I need help. Like, I planned all this and it's still really intense. And I remember being in the birth tub and I wasn't very grounded, just all those things. So although it was textbook on paper, it was not a great experience for me for the birth. And then I had really bad postpartum anxiety after as well.
Mm-hmm.
Can I just dig deep into some of the things you just said? Because that's sort of what I do. First of all, well, I'll kind of work our way backwards. The fact that you said you dissociated from what was going on because that's how you were able to get through that. Is that am I understanding that?
Yes. Mm-hmm.
Right. So it's interesting that you should say that, because today we had a lecture from the wonderful Gloria LeMay, and she was, among others, she's a storyteller. And one of the things she's talked about is she called somebody up there from the audience who had a headache. And she actually resolved the headache in a matter of about 5 minutes I just took some notes, and she says, ultimately what she says, what you resist persists.
Mm-hmm.
So going with the pain, making it bigger and spreading it out, or in your case, dissociating, was a way to not focus on it. So that was you figured it out yourself. You didn't have a Gloria LeMay to walk you through that. But also, a lot of young people who have medical issues become very, very OCD-ish about medical issue, about that stuff. They're very controlling about their life, whether it's a young type 1 diabetic or even somebody with cystic fibrosis who Bliss knows very well. They become very intense. So it's hard. It's monumental to overcome that you were able to overcome that and have a home birth and not sort of be even, I mean, both could be very traumatizing for somebody. So I'm excited to hear that you were able to do that. And I hope that our listeners will appreciate the fact that, even though the medical experience sort of maybe pushed you away from medicine, it doesn't always do that deep down psychologically. Deep down psychologically, sometimes it's very hard to let go of that. So you're able to do that. And one of the things that I really was impressed by was your medical team, or the OBs that said, just give her some aspirin and B12. I mean, I'm shocked by that. I'm surprised they didn't do testing and CAT scans up the wazoo and have you on heparin or have you on warfarin or Lovenox later in pregnancy and all those things, because I just know that so many MFMs would always, quote, err on the side of caution and over medicate you. So can you comment on the fact that these guys were so
lax?
Yeah, well, not lax, so reasonable.
Sure. So I actually saw an MFM before I got pregnant. So it wasn't a matter of, okay, this is going to be my team for my pregnancy. It was, hey, in this one appointment, tell me what you think. It was more like, here, I'm a case sitting in front of you. What do you think about this? And I think the physician, the MFM who was there, I think he was getting ready to retire, actually. And we talked about things like B12. I have an MTHFR mutation. So we talked about, methylated supplementation, all of those things. And he was so open-minded. I actually sent him a letter about methylated supplementation. He gave me a call and he said, I have never seen this before. This is amazing. So it was sort of like a unicorn situation. And at that time, after I got pregnant, I was also seeing, because I knew I kind of wanted a home birth, but I needed to get my husband on board first, which he did immediately as soon as he met the midwife. But he, my family practice physician that I was seeing before I transferred to home birth care was, she was actually in the film, what is it called? Why Not Home? She had a home birth herself. And so I'm like, yes, this is the right call. So, going back to the stroke and that day and all of that, I didn't go in early enough because it happened on a Sunday. It happened on Easter Sunday. And it was just a little balancing and stuff like that. And I'm like, oh, maybe I have an inner ear thing. Then I woke up Monday and that's when the symptomology really started. I was having trouble finding my words, a harder time with balance, that sort of thing. And so it was too late for clot busting medication. It was too late for a lot of that. But they did go through the imaging and all of that, just not a lot of meds at that time.
Okay.
I would like to just acknowledge you for everything that you've been through. That's a massive journey. And it sounds like you really advocated for yourself in these subsequent conditions and with your pregnancy and with your doctor. So a big part of that has to do with the work that you did to get there and being willing to step up and share that information and educate. And that guided, you did say you kind of had a unicorn of a doctor, but at the same time, part of that recognition goes to you for the work that you did in getting there. I did kind of want to highlight something about your experience of your first birth that I find more and more and more with, social media is a beautiful thing. We get to see all kinds of images. We get to share information across the globe. There's lots of beauty in that, but there is some downside in terms of our expectations of, if I do the work, I'm going to get the birth I saw on Instagram.
Yes.
Or I'm going to do all these things and I'm going to have that orgasmic birth or that birth that's pain-free, or I'm going to breathe my baby out. And I think that the real soul work, the real, like when we do the mind, body, spirit, right? The real soul work, the real stepping across that threshold as an initiation into motherhood, we don't know what our lesson is. You know, our lesson could be we have a really long labor, or we have a baby that gets stuck, or we get transported, or we have a glorious, easy birth. We don't know what our soul's journey is needing. And I think that the more that, and I'm not even saying this for you, because I'm sure that through all of the experiences that you're about to share, you kind of got there. But I am sharing it for our listeners because I think it's a really important thing to underline, because I just hear so many people say, I did all these things and then this happened and I was so disappointed. And I think the more that we can stay open to understand that life is light and dark, and birth is a microcosm of life, and that if we hold the context of each one of them is going to have a lesson for us, and it might not be what we can control or pick, then we have less suffering around the experience. We can hold it inside of like, wow, huh, that was a doozy. And I might not even understand all the lessons that I'm going to get to learn, but I know that I'm growing and expanding inside of this experience. So that's what I wanted to say about that. I don't know if you have anything to add.
You just summed up like my entire experience.
She's good at that. She's really
It
good
was
at that.
beautiful. Oh, it was absolutely true. Absolutely true. Because okay, so fast forward, like early 2023, it was so on my heart to start talking about, or to start praying for and intending for increased capacity. And in my life altogether. So like my ability to look at everything, life as a whole, whether that was nervous system resilience, or peace in my home, or just being more present in my marriage, my finances, like all of these things, I really, really was intending to increase my capacity in all of these areas. And a few years before that, like my cycles started getting a little goofy, and so I did the work. I did like herbal supplementation, just all of that, a lot of balancing, and I felt really, really good. About February or March timeframe, I told my husband, okay, I think we're ready to I'm ready to try again for our second baby. And I told him one time. And then I put the ball in his court. I didn't say anything after that because I didn't want to push it. And July came around. Is this okay that I'm continuing like this? Okay. So
Yeah.
July comes around, and he said, okay, I think I'm ready now. And I'm like, okay. And for some reason, I just stopped and I hesitated. And I'm like, what is going on here? Like, I've been ready for months, but something inside of me just really, really knew that this journey was going to be huge, like really, really profound, and something that was bigger than myself. And so I was honestly, I put this on my Instagram post about this. I was arguing with God, and I'm like, oh, really now? Like, really? Like, what is this about? And so I ended up saying yes. We got pregnant again the first try, which is I'm so grateful for, because that's not the experience of a lot of people that I know and support. And one other interesting thing, this is what I was going to say about that July timeframe, to go off of what you said, Bliss, is that the very first post on my Instagram account, because it's called Triumphant Birth, and it's so profound to me that this name dropped into my lap at that time in July, like right before we conceived. Because the definition of triumph, I'll just read it, because I was reading this last week, I think. I'm like, oh my goodness, I cannot believe this all has happened. And then I went back to read the post that I did in July, and it was just crazy. So it says, successful conquest, spiritual victory, celebratory procession, to gain mastery, to prevail, to jubilantly succeed in an epic or spectacular way, the state of joy and celebration. So that's what I wanted in all of the ups and downs of life, like through all of the capacity that I would hold. So that's kind of where my mind went when you were talking about holding the entire experience. And that's exactly what I want to put out there for other people too. So anyway.
And I think as you continue with your story too, it's like, if we look at a certain measure in time and assess where we're at, that's not including the whole journey. So you can have this intention and notice maybe this isn't exactly where you want to be, but the lessons go on over many, many, many years or decades sometimes. It took me 20 years to get on the path as a midwife, you know? So I think that we also have to understand that our culture is so interested in things happening so quickly, and we're so impatient, and we think that like it's going to happen tomorrow. Just holding the space as is your story is about to unfold, that the intention of growth and expansion inside of this, and knowing that it's coming. Life is long. Hopefully we continue to grow over our whole lifetime. So being patient with that and knowing that just because you don't have the answers today doesn't mean the answers aren't coming for you at some point. So
Right.
please continue.
Exactly. Yeah.
Well,
So
I'd like to just add that your intuitive knowledge is something that I think gets lost on a lot of women in today's, rapidly clicking social media, short attention span, immediate gratification world that we live in. Because I'm assuming that no one told you that you needed to like get your body in shape and do all these things, that you just intuitively knew that you wanted to prep yourself by getting really healthy before you guys decided to start for pregnancy number 2. And I think it's really important because there's a lot of data out there that says sperm quality, egg quality, and stuff really can be improved by simply doing the simple things like eating healthy and avoiding certain perfumes and cosmetics, and doing things to get your body healthy. And a lot of women they're in their 30s now, and they haven't really thought about it, and they're going to just start getting pregnant, and they try and try and try, and they're not getting pregnant. And then they go see somebody and they start to purify their body and get these things squared away, and then things seem to work better. So it would always make sense to do it first. And so hearing you just say that, that's coming out of that you just figured that out for them yourself, is just really important. That I want our listeners to hear, that if anyone's planning to get pregnant, plan it like you would. I mean, I don't want to get into the wedding analogy again, but plan it like you would anything else. You don't just go buy a house. You look at your finances, you talk about it, you look at, the neighborhood, you check out the schools, you do all these things first before you do that. It's the same thing before you're going to get pregnant is get your body in really alignment. Look at the food you're eating, read the package ingredients, look at the cosmetics and perfumes you're using, the shampoos you're using. Don't have that silly little Christmas tree thing hanging in your car that someone talked about today. Where because it smells nice in your car, because who knows what's in that thing. Careful with plastics, careful with all these other things, the toxins in our world. So again, I just want to emphasize that, partly because I've been so enlightened over the last 6 weeks from the wisdom of women from all over the world talking about these things. And I want to incorporate it into our podcast so people can hear it and move on forward.
yeah.
Thanks, Stu.
And of course, everybody's journey is so different, but I actually see it as the beginning stages of parenting, because those are that's you're creating what is going to be building your child. So everything from preconception through, we'll get to the sort of the end of the birth story, all of that I see is parenting in the pregnancy as well. Yeah, so the other thing that was crazy about the capacity piece is that so we go for the first attempt of conception, and then 3 days later I take a Zumba class and I tore my ACL. And I'm thinking, ha ha ha, God, this is such a funny joke. Like, I should have been more specific. Now I need to have the capacity to heal my knee, and I didn't know whether, deep down, I knew that I was probably pregnant. I could just sort of feel it. But I'm like, okay, ideally I would tear my ACL not being pregnant, be able to get the imaging, be able to get it fixed or whatever, and then move on. But it turns out that was not the biggest capacity piece that would be in store for me. So,
Oh, so wait, so what happened with your ACL? 3 days,
nothing.
right? Oh, you didn't have any.
I go for imaging next week because the surgeon that I saw, excuse me, at the orthopedic walk-in place, he said, come back when you're 1 or 2 months postpartum with your twin. So I waited, I waited the 2 weeks, confirmed, took a test. We didn't do any imaging in the meantime. And then I had my appointment and I said, what could we do? Because I was looking at stem cells, I was looking at all the other things. And he basically was like, no, I don't do any of that. Even though I know that he does it for the Green Bay Packers. I'm still a little bitter about that. But anyway, I didn't end up doing any of that. And I just said, okay, I'm pregnant, I have a baby. I know that there's a ton of stem cells floating around, probably all in my uterus, but why can't a few of those travel to my knee? I'm like, it's not going to hurt anything. So I'll just try to send those to my knee and do everything I can in the meantime to keep it healthy, do some physical therapy, and here I am. I actually go for imaging next week because I'm finally out
From
for
a
months.
personal question, I tore my ACL back in 1981,
Mhm.
and I knew it right away because I heard it, and it also hurt like crazy.
Yeah.
So if they didn't do any imaging and stuff like that, just by exam or just by your history, they knew you tore your ACL. How did they figure that out?
Yep, they had 4 different people look at it, and the surgeon said it was torn. It was just a matter of if the meniscus is torn, but they said the ACL is definitely gone.
Wow, and wasn't that uncomfortable?
Oh, it was uncomfortable.
Okay. Nothing like labor, though, I assume.
Oh, it different, just really different. Yeah.
Okay.
Yeah. Yeah.
Okay, so now you're
Now you're
pregnant.
no, and now she's Superwoman too. Besides that,
Oh, the other thing that I wanted to say that was so funny is that when I was pregnant with my son, I wanted even though I was having a home birth, I really wanted an early ultrasound because I just had this feeling that there were 2 babies there. And I was really, really surprised that there was only 1 baby there. And so for this pregnancy, I'm like, nah, I don't need an early ultrasound. Like it's just one. That must have been like a fluke feeling last time. But it's so funny because as I was preparing my body for this pregnancy, in my mind, I just thought, oh, well, I'm just going to be super prepared. I'm going to avoid, all the postpartum depletion. I'm just going to eat and prepare as if I'm having twins. And so that was telling also. I did not I didn't want the normal 20-week anatomy scan. I just wanted something a little bit lower level. I just wanted to take a peek to see if there were any gross anomalies. It just really felt in my soul that I wanted minimal ultrasound for some reason. And it took me a while to find a place that would do that. And once I did, it was 24 weeks. And so this was right before Christmas. And I have one story before that. So before I went for that ultrasound, I go into my midwife's office. She had a midwifery student with her. The student palpates my belly and she said, oh, this baby is definitely breech. And the midwife kind of looks at her and raises an eyebrow and it's like, well, let me see. Comes back and palpates, oh, this baby is definitely head down. And it turns out that they were both right because they were looking for a second baby.
And you had no intuition or instincts or growing bigger or any of that before 24 weeks?
I was huge. I was huge and I was gaslighting myself. I'm like, why am I so winded? This second pregnancy thing, I know you get a little bigger, a little faster. So I'm like, I don't know. I was just trying to let my body do its thing. And then, December 19th, we found out that there were 2 babies. And at that point, I'm like, yep, I knew it. And I knew it enough, I guess, ahead of time that I did have my husband take a video. And I cannot forget to say that when I was about 10 weeks pregnant, my son would always tell me, there are 2 babies in there, a boy and a girl. He would tell me all the time. And I'm like,
Kids
yeah,
know.
okay, okay. Because
Yeah.
then in the next breath, he would say, there's 6, there's 7, there's 8 babies. And I would be, yeah, okay. But he
I'm having
still
a
tells
litter.
me, you're right. He still tells me I was right the whole time.
Mhm.
So yeah,
All
so
right, so you're pregnant with twins, and now what?
and now I call my midwife. She is doing a very good job of being neutral about it because people react in different ways. I was really excited. Um, and she did some research. So she called my neurologist that did the stroke workup in Madison. She did some different digging around, and in the end, at around between 29 and 30-ish weeks, she called and said, we did a FaceTime, and she was no longer comfortable supporting my pregnancy at home, being with twins and with my history. So she said, why don't we give Christine a call? And my mouth dropped and my eyes opened so wide. I'm like, are you talking about Christine Loria? She's like, well, yeah. And I listen to your podcast religiously, and I'm a birth worker. So all the other amazing podcasts, and I knew very well who she was. And she said, oh yeah, she's just a couple hours away. I'm like, are you serious? If she comes to my birth, I am going to need to prepare, like the queen is coming, all of these things. So it turns out that she was available. And the only stipulation was that she wasn't going to attend as a primary midwife, but she would definitely attend as like a consultant. And I was over the moon thrilled about that because it was like the red carpet was being rolled out for me. She is one of the best
In
in
the world.
terms of teaching, breach, all of that, as you know.
Mhm.
So I ended up establishing with a birth center that I had been to many times as a doula, supporting other women. And that was our plan. It was the midwives at the birth center would be primary, and I still wanted a home birth, but with their client load, I agreed to go there.
Okay, great. And then you're in labor?
No, wait, before
Yeah.
we get to labor, so you had a scan at 24 weeks. They saw you had twins.
Yep.
Because I already know at the end of the story, I already know that there was that one was like 7 pounds one and one was like 415 or something like that, right?
Yep.
Did they recognize that at 24 weeks, or was it was a scan just to determine twins? And then did you have any other follow up on that, or was it just leaving it up sort of to God and to your intuitive knowledge?
Yep. So they saw a definite septum, and we knew they were die. I did decide to find out gender at that time. So we knew shortly after that it was
Right.
boy girl. And so we knew that it was definitely die. And, so there wasn't that sort of looming thing of twin to twin transfusion, all of that. They were similar sizes at that time at around 24 weeks. So there were no concerns at all. And then we did a follow-up ultrasound at, 33 or 34 weeks, and it was hard to get good measurements, especially of baby B's head. And so we knew that he was a little bit smaller, but everything looked fine. He was moving fine, all of that. And so that we couldn't get a super great measurement that was specific.
And the person that did that scan, was that the same person that did the earlier scan, or was this now an MFM that did it?
Nope, it was the same person.
Right.
It was
Okay.
a
Good.
private, yeah.
Right. So somebody that wasn't an alarmist
Right, through the birth center.
through the birth center. Good. Just another public service announcement for our listeners is when you want to try to do it your way, you've got to be able to have the people around you that are like-minded and try to avoid getting off road, so to speak. Right.
Yeah, and it wasn't an easy decision to make about who to go to either, because obviously we want to be prudent in in the parenting. And so we had a Zoom call with all the midwives at that birth center and Christine, for the midwives to say, hey, what's your comfort level with this? And we talked through all of that. And at the end of the conversation, everyone was comfortable and on the same page.
Great. That's always a challenge and a feat when it does happen amongst, multiple midwives because we do feel more comfortable with some things and not with other things. So
Right.
So,
again, the universe was supporting this.
so the last ultrasound you had was at 33 weeks then?
Yes. Mhm.
Okay, so they knew that one baby was, did they know the positions of the baby just by palpation, or did they, was was it unknown at the time you went into labor?
We knew baby B was breech and
Okay.
baby A was head down. Yep.
So imagine that, people, that you can actually know a baby's breech without having an ultrasound to know that baby's breech. It's just, yeah, that's, again, people don't understand, medical people in the medical world don't understand how you can actually use your hands and figure that stuff out.
Mhm.
Right, because we're not taught that.
Yeah, but it does happen all the time.
Right.
Exactly.
Okay, so you had vertex twins, and then how far along were you? Vertex breech twins, excuse me, and how far
Yep.
along were you when and tell us about how labor began.
Sure. So I had prodromal labor for about a week, a little over a week. That started at 38 weeks. So the one morning I woke up and it didn't stop on Palm Sunday. And I'm so thankful that I had those two big contractions in the morning, because otherwise it would have just been that same pressure that you have with twins. And Braxton Hicks start at, for me, they started at like 21 weeks or something like that. And then the prodromal stuff started happening. And I'm like, okay, this is just normal life. I got through the mental hurdles. And then at about day 3 of that, and then I'm like, okay, this is just normal life. So that Sunday I wake up, okay, normal life, normal life. And then I
Hold
had,
on, Jamie. Jamie,
yeah,
just a question. With the prodromal labor, were you able to sleep
no.
for a week?
Yep. I took such long naps during the day though.
Okay, so you did sleep, but it just wasn't always at night because during
Right.
the night the contractions were stronger. Did your discharge change during that time? Did you see any show? Did you see anything like that?
I didn't have bloody show, but I started losing my mucus plug at that point.
Okay.
And then a couple days before labor started, I saw just very, very faint specks of blood. And then that night before, I did have a little bit of bloody show, but it really wasn't much at all. And then I had the two big contractions, some bloody show, and then that's when I knew it was on.
Right. And so during the prodromal part, it was kind of like questionable, but when it was on, you knew it was on. There was something
Yes.
distinct and different, right?
Yep,
I think that's
absolutely.
good for people who are having their second, third babies to know because prodromal labor and kind of these stop starts are very common. It's like the body just is preparing and getting ready. And I think your point to like wrapping your mind around, like, again, context is decisive, right? Like, this is just normal life. This is what's happening. The more I just flow with it, the more I'm not going to be struggling with the reality. So great. So you knew labor was happening. And then what?
Yes, and then it was going to be about 40 minutes until my mother-in-law could pick up my son. So we waited there, and then there was a whole fiasco with the baby's bag, and didn't we pack that, and isn't it in the vehicle, and all of that. So that was a 15-minute delay or so. We got to the birth center around 12:30. And we were only there about 2.5 hours before both babies were out.
Well,
So,
perfect timing then.
yeah. So Christine had told me, when you have the thought to go to the birth center, give me a call. And so she was doing a podcast that morning. It was after that. So I had the two big contractions, sent her a text, and she said, okay, I'm packing up and on my way. She was a couple hours away. So she showed up like in the perfect timing. It was fantastic.
Great.
Yeah,
So
it's
tell
the
us about
best.
the birth.
As a consultant and a home birth doctor myself, it's always great to show up just about a half an hour before that, so you're not laying around for hours and hours and hours on end. For both purposes, for the comfort of the practitioner, but also for the privacy of the family. You don't need people sitting around your kitchen or your living room when you know they're there. So that seemed to work out great. Now you had to get in the car and drive there. Nothing slowed down when you got in the car, right? You weren't that was on.
It was on, yeah, nothing slowed down. I do remember specifically that, so music was really important to me, and was really grounding. And it's funny that, I'm a doula and I tell people all these things and I know spinning babies, and I really did nothing. I just felt no pull to do anything specific to prepare. And the work really was just staying open, which surprised me compared to my first experience because I'm like a doer and a preparer and all of this. I just never had that pull to do something specific to prepare. So we're in the car and I have my headphones in and I have my worship music on. And I am just like, the bumps suck, and the turns and stuff are not fun, but I'm like relaxed. I'm doing my thing. I'm trying to get in the zone. And my husband is so tense. I'm like, okay, these headphones have to come out. We have to put it on in the vehicle. And as soon as I do that, he kind of, he exhales and the whole energy of it changes. So that's something that happened early that was really important. And we got to the birth center, and I remember thinking that this must be going faster than I think it is, because I walked in and the tub wasn't filled. And I'm like, you guys, this is a 40-minute drive. You had time to fill the tub. And I was like irritated. Like, what is the problem? And that's actually one of the most, out of this whole story, it's funny because that's one of the most negative emotions I had during the whole thing. And so I was laboring on the bed, and the feeling that was there at some point, it was like nothing I've ever experienced before. I remember leaning over the bed. I had my hands up like this, and my whole intention for this birth was to let it be an act of worship. Let me do it with joy and just be open to what's going to happen. And so I'm like, okay, like just having that intention. And I feel I've heard it before being described as the cloud of witnesses, but it's like everybody who has gone before me. It's the mothers and the fathers and everyone. And it's like heaven opened up and was just present for my birth. And I get so teary every time. And yes, it's these people and it's the grandparents who, I couldn't see it with my eyes, but I saw it in my spirit. And they were there. So it was so tangible and like thick, and they're just like angels around. And it sounds crazy unless you've experienced it before.
Not for us.
Not for us.
Right. I'm with the right people here.
And other people might refer to it as their ancestors, like calling them
Right.
ancestors. Yeah, but
Mhm.
yeah, they're there.
Yep. And so there's that whole, the veil is so thin, and I'm feeling all of this. And as intense and just, I guess intense is the wrong word, but as profound as that is, feeling all of that, God is just in the center of all of it. Like I feel so centered and grounded, and I'm just in the middle of this experience, and it's the safest that I've ever felt in my life. It's the most like at home that I've ever felt in my life. And it's like, what else do I need? I don't need spinning babies right now. I love Gail and I love spinning babies and I use it all the time, but I'm great right now, and also it's painful and it's intense. But I was able through that to really release and let go and relax my body. And then finally the birth tub is ready. And there were several points in this birth that really felt like ceremony to me, and I didn't feel ceremony in my first birth. And one of those times is the midwife, one of the midwives putting up my hair and getting me ready to go into the tub, and like going into the tub. And I knew that my baby girl was going to be born in the tub and pretty soon. And she was. So I remember Christine was there at that point. I remember looking at Christine, and at one point, when my water broke, I knew sort of what it was, but I looked at her and she was like, "Yep, that was your water." Nobody talked, much at all, which was absolutely perfect. But that was one time I looked at her and she's like, yep, that was your water. I'm like, okay, good. And then my body just started doing this rocking thing, and my doula brain is like, oh, that baby must be moving down. And it's like I'm observing it from my brain, you know. And yeah, so eventually baby girl is coming down, and somehow my body is able to just hold her there, and so my tissues can stretch, and my arms were floating in the water, and I don't honestly know how I was able to do that. It wasn't of my own strength and power, like I was tapping into God at that point. And and then eventually she came out, and I don't know how long I pushed. I don't think it was very long at all. And I pulled her up, and I felt another release. And immediately I knew it was her cord that snapped, but I could not say it. I could not verbalize it. And it's one of those like cringy things from the birth experience. And all I could do was like my eyes were darting around trying to make contact with the midwives, because they at first probably thought it was a placenta or something. It didn't take long at all before they realized it. And when I was able to kind of come back after a few seconds, I went, and they first went for her side of the cord and got that. And then I went for the placenta side of the cord, because I didn't want that to like retract and then we had to go fishing for it or something. I'm not sure how that worked, but it snapped right in the middle. And I had never actually seen that before. So they took care of all of that. And there was blood in the tub, of course. So they said, okay, let's, why don't we get you out just to make sure that it's not a placental issue or anything. So I did that. All of that was fine. That, by the way, is a wild experience. Getting out of the tub after you birth one baby, you still have one in, and you have a torn ACL. That was crazy.
Yeah, well, before you go on to the little boy, because that's interesting. Again, I've seen your video probably 20 times. And yeah, the snap is completely visible on the video, as you know. And when I show it to my classes and stuff like that, there's an audible gasp. And but the truth is that all other mammals, the cord severs, and we all panic that the baby's going to exsanguinate. But I don't know that nature would be that stupid. I mean, we're never going to do a randomized trial to see what happens when you let a cord bleed out like that and how fast it would stop. But was there any concern after the birth, hours later, that the baby looked pale or anything like that? There was nothing about that. So
No,
and how much time elapsed between the snap and when they finally recognized it and they actually pinched it or grabbed it? Was it just seconds, or was it more like 20 seconds, a minute? What was it? Do you know?
It was seconds. I don't know exactly how many, but I know the video cuts off, but
Yeah.
it was like shortly after that. So it wasn't long at all. It feels like absolutely forever when you're watching it, but
Yeah.
it really was fine. And her apgars were fine. She was crying the whole time. Her color was
Oh
good.
yeah, she looked great the whole time, right?
Yeah.
Right. Oh,
Yeah.
so I just want people to understand that can happen. And a lot of twins, by the way, will have a shorter cord. And it didn't look that it was that short, but it was obviously short enough that you couldn't pull the baby up all the way to your breasts. So without it snapping, and that was a really healthy looking cord, and it snapped too. You'd think that the baby would go boing out of your hands and back back down, but the cord
Like a
went,
cartoon.
and so it's not unusual, but it's not. I mean, it's urgent to fix it, but it's not a panic situation. You just go ahead and you find the other end and you hold on to it until you can get a clamp or something and put on it. And just a reminder, because no one goes in and clamps the umbilical cord of any other species. It's not done. And those babies don't bleed to death. So the cord would probably spasm really quickly and probably shut down. That's probably what would happen. Anyway, it's dramatic on the
And
film.
the irony of going to a birth center so that I could wait for an hour or whatever to cut the cord, and then it snaps anyway. So that was like, oh, okay.
Yeah.
So yeah, so I get out of the tub, and they confirm that everything with the placenta is fine. I chat with Christine for a minute, and she's like, yep, everything's great. Midwives say everything is great. And so I end up laying on my side in the bed for a little bit, and it took probably 15 minutes or so before contractions started picking up again. So I'm just, holding my baby and taking a break, and then contractions start picking up. They're sorry, my words are gone. They're monitoring the baby. They have the Doppler for baby
Yep,
B.
they're listening to the baby. By the
Yep.
way, before you go any further, there is in the video, there's this beautiful still shot of you sitting on the bed with this huge smile on your face. I don't know if you remember it. I mean, it's one of the most beautiful Madonna-like pictures I've seen. So it was gorgeous. If you haven't seen it, everybody should. Is it still on your Instagram page?
I have still photos on there. I have my birth story, and probably I have over 100 slides of the birth story there with words on top of it. So I don't know exactly the one you're talking about, but maybe it's there. Yeah.
Yeah. Well, I'll look and I'll let you know. Okay.
Okay.
So go on. So because baby B got a little bit exciting, I think.
Yeah, so it's they're monitoring baby B, and he was great up until he wasn't great anymore. They had it's a little bit of work to find baby B after baby A comes out because he was moving around and things, but he did stay breech. And at one point they were having a little bit of a hard time just locating the heartbeat, and so they brought out the ultrasound. They have a little bedside, like I think they call it a butterfly ultrasound that they do. And so I could hear it clearly. And there's a video where you can hear it, and I remember it too. I'm looking at the midwives and it's going dun 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 dun, like, oh, and I look at them and I'm
Every
like,
birth worker, there's this rule that the birth worker's heart rate is inversely proportional to the baby's heart rate. So
yes.
It goes up as it goes down. Yeah.
So I listened for maybe 7 seconds, and then I said, should I get on hands and knees, as I'm getting myself up onto hands and knees because I'm going to do that anyway. And they're like, yep, yep. And they were truly so calm about it. And this for me was just, the next thing. It felt like the next phase in parenting. Like, this is just what you do. And my heart rate was probably higher, but they asked if they could break my water. They said it was about 70s. I didn't hear the number at the time, but it was about in the 70s. And so I consented to them breaking water, and they said, okay, let's, push right away. And I don't remember exactly the words, but they did ask permission, which I'm thankful for. And he was out in 2 pushes after my water was released. And so I pushed, and he was all but at first. I think Katie, when she did the exam, the midwife, she thought it was a foot because his butt was so little, and then she's like, oh no, it's a butt. So he came out to pretty far down with the first push, and then they're like, okay, take a breath. I took a breath, and I'm like, do I push with a contraction, without a contraction? And I know that you push without contractions during breech deliveries, but I, wasn't in my doula mind at that point.
especially when there's a sense of urgency, you're not going to wait for another contraction.
Yep. Yep. So I pushed again, and Christine said, reach down and get your baby. And I didn't know I was that close yet. And so Katie I saw in the video, I didn't actually at the time know that she was assisting as much as she did. And she didn't have to do much. She turned the shoulders a little bit and gave a little shoulder press. And then I reached down with my right hand and kind of hand over hand with hers and brought baby up to me. And I had told my husband ahead of time that breech babies sometimes take a little longer coming around. They might be, a little blue, a little floppy, not breathing as well as head down babies. And so he actually, when I talked to him after, he was not scared about this at all. But baby was taking little gasps, I wouldn't even call it a gasp, just little breaths. And I don't remember exactly what the conversation was, but Hannah, one of the midwives, helped me hold him. And I started giving him breaths. And it was that same sort of like, okay, come back into your body. Like you have to focus now. And it took me a little bit to get it correct, like get everything the way I needed it to be over his nose and mouth. But it took a couple times, and then at that point I started giving breaths, and it felt like an extension of my lungs. It's like, this is just what he needs. This is just parenting. It's like the breath is coming out of my lungs and going into this tiny extension of my lungs and coming back. And so I did that a few times, and I knew that it was getting better. Like I could sense that he was improving, but he hadn't cried yet or taken a gasp or anything. And at that point, I remembered, this is what I wrote the letter about. It was your episode 300 from when Bliss was in Bali. And there was a story where one of the midwives there was resuscitating.
Robin Lim.
Yes.
Robin. Mm-hmm.
Yeah, she was resuscitating a baby and had said, okay, I'm going to give you one more. And I think it was a much more dire situation in that story. But I remember her saying, okay, I'm going to give you one more breath and then it's your turn. And it just landed in my soul when I had heard that episode. And in that moment, when I was holding my baby, I remembered that. And I always believe in talking to the babies when they're in utero, when they're out, because they're sentient, they're here, they know, they're brilliant. And so I said, okay, I'm going to give you one more breath and then it's your turn. And so I gave one more breath, and then I paused and he gasped. After that, he took a breath, and people were relieved, but they expected this. We expected this, this sense of just being supportive so that the journey could take whatever route that it was going to take. And I gave a couple extra, supportive breaths after that time, but his color came back quickly. He had APGARs of 4 and 8. So
It's not atypical for a breech baby,
Mm-hmm.
even a singleton, but certainly for a second twin, that's within reason. I mean, statistically speaking, 1 minute APGAR scores on breech babies in general and breech second twins is going to be statistically lower than 1 minute APGAR scores on head down babies. But by 5 minutes, there's generally no statistical difference, and that's what happened here.
Yeah.
Right.
Jamie,
And
I
without
have
any, oh, go ahead, Bliss. Sorry.
Sorry, Stu. I have a question. Did you guys discuss that you wanted to give breaths prenatally, and that was something that you prepared for ahead of time?
I don't know if we talked specifically about me giving breaths. There might have been a question where I said yes. But I mean, they knew that I wanted to do everything myself as much as possible, including pulling the placenta out, just, all of those things. And so I think it just, if it wasn't explicitly talked about, it just kind of went along with how I wanted the birth to go in general. And of course they were around me prepared, but they trusted what the situation was as well and what I was doing.
Beautiful.
Yeah,
And the other thing I kind of wanted to underline when you were talking about the baby's heart rate, just for those of you who maybe aren't so familiar, 70 is something that we would definitely be very aware of, but it's also not just the number. It's if it's coming back up too, and one that consistently is staying at 70 and not recovering is something that is a little bit more urgent than something that dips down to 70 and then comes back up to more of a normal baseline. There might have been a little bit more wiggle room with something like that, but with that low of a heart rate, that's consistently that low, that was a really obviously appropriate course of action to break the bag and try and expedite the delivery.
Right. I don't think anyone wanted to wait around and see if it was going to rebound.
Exactly.
And when we saw the 70 or heard the 70, that moment to baby being out, I think was 2.5 or 3 minutes.
Perfect. Yeah.
Yeah, and I would say that this is not an uncommon thing with baby bees. And the fact that you said that there really was no explanation as to why that happened, which is also very common. I've seen it even an hour and a half after A comes out, where B's inside, has been cooking along, doing just fine. And then for whatever reason, there's no bleeding, the contractions didn't get suddenly stronger, and suddenly there's this what we call a bradycardia, where the heart goes down. And I don't know, maybe it's an altered blood flow, maybe the placentas are beginning to shear off. Part of it, this spiritual thing where
They
at
missed
some
their
point,
twin.
what? It's
They
missing,
missed their
its
twin.
sibling. Yeah, it's
Yeah.
missing its sibling. It finally realizes that I'm all alone.
Mhm.
And that sort of thing. So, um, right, I don't know why it happens, but I know that a skilled team like you had, just the way you describe them, remaining calm, letting things happen, being prepared to do something if necessary, but letting you have the birth that you desired is something that there are rare instances where that will happen in a hospital, but for the most part, that's never going to happen in a hospital. I mean, they're going to push the panic button on the wall. The NICU team's going to come down. They're going to want to, they're going to do a breech extraction. They're going to want to get that baby over to the warmer. They may even cut the cord instead of resuscitating the baby right there. Things are changing in some institutions, but again, because I had the experience of spending a lot of time in Australia, there's still a lot to be done. There is more resuscitation with the cord intact in Australia than I anticipated would happen, that I see happening in the United States. I know the experience would have been utterly different. First of all, they probably wouldn't have let you have a vaginal delivery with a vertex breech twins. I mean, 75 to 80% of twins at this point in the United States are sectioned. And only 44% of them are vertex. So, I mean, 44% are, so you're getting a lot of those are getting sectioned too. And the guidelines don't, I mean, not that I'm a big fan of ACOG, but ACOG's guidelines say there's no reason to section twins just because they're twins. And yet
Amen.
that gets ignored. So I just have great respect for your team. And again, watching the video, watching them sort of calmly be around, I could see the little concern on the midwife's face when she's listening, looking for the heartbeat. So I think that's when they went to go get the butterfly thing. But
Yeah.
and then suddenly the baby's out. So yeah,
Miraculously.
yeah, miraculously the baby's suddenly in your arms. It's like, how did that happen? Where did the rest of it go? I want to see the
Right,
rest of
I
it. Right.
know.
So Jamie, one last thing. One of the risk factors for twins is often considering the possibility of hemorrhage. Did you have any bleeding issues? Did you have any management? What did that look like for you?
Yeah, I did. So after the placenta came out, I started bleeding, and it was managed first. We talked about it prenatally about how we would go about managing that. So we went through sort of our hierarchy. We did, herbs first, and then we did a few other things. And we had talked ahead of time about, not necessarily being married to a number with regard to like how much I would lose, because we know that twin moms typically lose more blood than singleton moms. And so we had talked about like 800 to 1,000 would be about, that would probably be our threshold, our upper threshold. And I agreed with that completely. But more importantly, the focus was going to be on my vitals and how I was responding to everything that was happening. And so my vitals did dip down, and what they had seen is that, a lot of times it comes back up after about an hour or so, but mine were just not coming back up. And so there was a gradual decline in my vitals. They did IV oxygen cytotech, lots of eating and drinking, glucose packets, smelling salt at one point, because I started to really decline. And that's when we both mutually agreed to transport to the hospital for that. And so I did go to the hospital. I got 3 doses of epinephrine in the ambulance, and I arrived in the emergency department where they hung Pitocin, did a uterine sweep, gave me fentanyl, and I really thought I was just in this state where I thought they were being so dramatic. And I laugh about it because it's like, no, the further away I get from the birth, I'm like, no, that was really appropriate. But at the time, just the whole thing had been so calm. I think I was just like, you guys, calm down. Like, I'm here, I'm talking to you. I looked at the ER doctor at one point because I'm like, I don't really want blood products. But after they did this sweep, I lost another 700. So it was at 1.7 liters. And I said, okay,
7 liters? No, no, no.
1.7.
Oh, 1.7.
Yep,
Okay.
yep,
Better.
Because you probably don't have 7 liters inside of
No,
you.
no.
Well, you might, but
And I said, If I don't get these blood products, am I going to die?" And I asked that question kind of tongue in cheek, fully expecting him to be like, "No, but blah, blah, blah," just so we could talk about it. And he said, "Yes." So I'm like, all right, well, fine. So I got blood products, and I was transferred to the postpartum area. The midwives at the birth center nursed my babies for me, which was fantastic. And then they brought me the babies after I was stable. I did have a chance to nurse them before I left. They helped me with that. But in the meantime, there were midwives who were also breastfeeding, and they helped me with that as well. So after I was reunited with the babies, that night I had another bleeding event, and that would happen a couple more times. So I had the babies on a Sunday. I didn't go home from the hospital until Wednesday, and I had a few different bleeding events, and it just kept happening and happening and happening. And so in total, I lost 4 liters and got 6 units of blood. And at one point, the OB came into the room and said, "This is driving me nuts. I normally have this whipped in an hour," because my fundus was firm the whole time. And so, they give something and it sort of stops, and then they think, okay, I'm not going to give anymore. But then it kept happening again. And I had the most healing conversation with him before I left, because at one point he came in and he said, "Okay, if you lose 100 mils more, or 100 cc's, whatever, more, I want to take you back to surgery." And at that point, I said, "Yeah, fine. Like, let's figure out what's going on." They still have not figured out the cause of the bleeding. I assume it's not a TXA deficiency, which they they gave me the whole course of things. But when I sat down with him before I left, I told him, "Look, I'm nervous. What if I start bleeding at home again?" And he said, the long and short of it was that he said, "Look, I have bias because you came in from a birth center, and I wanted to be really conservative with the medication. And I think that if I would have hung Methergin in the ER, and been more aggressive with the anti-hemorrhagic medication, that this wouldn't be happening. This wouldn't have happened." But there's no way to know about it. And it was so refreshing to hear somebody in the medical profession talk like that. To have a physician be honest and open with me like that was one of the most healing things that happened in that whole birth. And we both got teary-eyed, and I said, "It's not your fault. This did not traumatize me." Even though physically, I mean, they did 13 uterine sweeps in those few days, and tons of fundal, the whole thing. But that was the most healing piece of it right there. And to then go back. So anyway, we get ready to leave. My husband has a memory pop up in his phone, and he said, "Look at this, seems like it's unrelated, but I promise it's related." He said, "Look at these pancakes you made me today 8 years ago." And I look at these pancakes, I'm like, these were bunny pancakes. It was Easter. I was actively having a stroke 8 years ago today. And it seems, like, okay, it's a coincidence, but it just really deeply felt like after having that healing conversation, this is a chapter that's closed for me now, that I'll never have to interact with within the medical system like that again, in that way, in that, sort of desperate energy where I'm being gaslit and all of that. It was so, so, so healing. And then fast forward to the conference, when I have the opportunity to talk to so many OBs who are open and willing to do this work. you talk about medicine, that's for me, that's where the triumph is. And that's where, it wasn't an ideal situation at all, but there's so much healing that came out of it. And I'm grateful for all of it.
And I think it just shows you were able to have a beautiful birth in the way that you wanted to. And when you needed medical assistance, it was there for you. And the balance of both worlds can really give us that opportunity to have more choice. So knowing that this is a risk factor is not necessarily an indication that you have to have a hospital birth, but with the right team and the right training, we know when it's time to escalate care to a higher level and get you what you needed.
Right. Exactly.
Yeah, beautiful.
I would like to just add too that a couple things. The fact that this doctor just was a simple act of human kindness by admitting that, he was feeling bad and that you guys would have a conversation about it, gives me hope. It really gives me hope that there's things will change out there, because most of the time you're not going to have a conversation like that. The hospital is going to get their dander up and they're going to protect themselves, and they're going to wall themselves out. It's just a simple thing like conversation like that. And look at how healing it was for the both of you. And then you said something about the ER. They seemed to, that everything was a little bit more hectic than it had to be. And I will tell you, there's something, it's a variation of what's called a Hawthorne effect. And the Hawthorne effect means that people act differently when they know they're being watched. And when you're in the ER, if you act calm, people are going to think there's something wrong with you. So you have to act out a little bit. You have to act. And that's why doctors will sometimes scream at a nurse or do something, because the more they scream shows that they care more than somebody who's being calm and gentle and sweet. Obviously, that person's not concerned and doesn't care. And it's all backwards. We know it's all backwards. But that is classically what goes on in the hospital. You have to panic is the norm there, because that means you're really concerned. And if you were acting calmly, then, there's a scene in the Heads Up documentary, the Breach documentary, where one of the women is talking about her experience with Dr. Wu, who's passed away since then, but had a great relationship with his hospital at that time. And he did a lot of breech deliveries there. And when she came into the hospital with her water breaking and in labor with meconium and a breech, she expected there to be panic in the labor and delivery area. And they said, "Oh, so it must be Dr. Wu you're dealing with. Okay, well, we'll call him and we'll get him in, and everything's fine," because they know about twins or breaches, and they worked, and the transition is smooth, and it works. And so there's a lesson really that Bliss mentioned too, is that when you have a collaborative, cooperative relationship, it works better for everybody, especially the woman we're supposed to be caring for, but also for the people that are doing the caring or the treatment. Wouldn't you rather work in an environment where everybody's sort of working together than being hostile toward each other? It just, yeah. And nobody was scolding you, sounds like, for having a home birth.
No, for goodness sakes, they did not say a word when my babies were in bed with me in the hospital, because the babies weren't their patients. And they didn't say anything when my parents were there helping me and, dozing and, all of those things.
So where in Wisconsin are you?
I'm in Green Bay. I had the babies in the Fox Valley.
Okay, so everybody who's having twins needs to move to Green Bay. Right. No, I'm not saying that. I mean, the birth center would be overwhelmed, and so would Christine. But nonetheless, wouldn't it be nice if those of us who are doing twins at home would have that sort of reception when we go to the hospital? It would be really nice. Right.
Jamie, thank you so much for sharing all of the intricate details of your journey, the spiritual, the advocacy, the triumphs of your experience. Is there any last thing that you just want to make sure that we know, or that our audience knows, our followers know about you before we say goodbye?
So I have just started a podcast and I'm super, super excited about it. I miss birth a lot. I miss going to births, and as you can imagine, having twin babies, it doesn't allow for a lot of space to go to births. I did that with my son. I attended some births when I was newly postpartum-ish with him, and it just didn't work out. So I'm stepping back, and I thought, well, what could I do to stay in the birth space in a way that is supportive for the community and that still supports my family as well. And I thought, well, I can encourage people and I can listen. And so I have the Triumphant Birth podcast that's out now. We just did a tiny little trailer, and I'll be releasing episodes weekly.
Yay. And we'll put all of your information in the show notes so that people can find you, find the podcast, find your Instagram account. But I'm so glad that I got to sit with you and meet you in person and hold your babies, because this experience of getting to hear more details about your life and your story is even more meaningful. And I'm sure that our fellow travelers are going to so enjoy hearing all of your story.
Yeah, and I
Thank
think
you so
your
much for
podcast
having
will
me.
be really uplifting too, because just the fact that you mentioned that Bliss and I talking to Rob and Lim in podcast 300 affected you. Sorry, I get emotional about this too. Affected you so greatly, and the way you talked about, telling your baby boy that it's your turn. You know, I have, again, I'm a little exhausted from all the traveling, but the rewards that I've gotten from just people coming up to me and saying, you've changed our life. We had a home birth because you did it, because of what you said, or anything like that, makes the little ripples we get. They're starting to gather together, and you have such a great voice, and your spirituality is really touching. And I'm hoping that people will subscribe to your podcast too, so that you can spread the wisdom that you have.
I just love you both. Thank you so much for holding space for me and for doing what you do. It just means so much. Thank you.
You're welcome.
You're welcome.